Are you struggling with premature ejaculation? This is a question that resonates with many individuals. Premature ejaculation is a common issue that can affect anyone, and it's nothing to be ashamed of. It's a part of the human experience, and it's something that many people grapple with on a regular basis. The good news is that there are solutions, methods, and techniques available to help manage and overcome this concern. This video is all about shedding light on these strategies, providing you with the knowledge and tools to take charge of your sexual health. We'll delve into a variety of approaches, from behavioral techniques to medical treatments and psychological therapies, giving you a comprehensive understanding of the options at your disposal. Remember, everyone's journey is different, and it's about finding what works best for you. So, are you ready to take control of your sexual health? Let's dive into the solutions. First, it's important to understand what premature ejaculation is. It's a condition where a man frequently reaches climax too quickly during sexual activity, often before or shortly after penetration. This is more than just an occasional occurrence. It's something that consistently interferes with sexual satisfaction and can cause distress for both partners. Premature ejaculation is actually quite common. It's estimated that 1 in 3 men may experience this condition at some point in their lives. So, if you're dealing with this, you're definitely not alone. But what causes premature ejaculation? Well, there's no one-size-fits-all answer to that, as it can be triggered by a range of factors. Physically, it can be linked to hormonal imbalances, abnormal levels of brain chemicals called neurotransmitters, or inflammation and infection of the prostate or urethra. On the psychological side, various factors can contribute. These can include early sexual experiences that may have established patterns of quick ejaculation, sexual abuse, poor body image, depression, anxiety, and stress. Even worries about maintaining an erection can lead to a pattern of rushing to ejaculate, which can be difficult to change. However, it's crucial to remember that the causes of premature ejaculation are complex and interwoven. It's not simply a matter of mind over matter or something that can be fixed with a single pill. It can be influenced by both physical and mental health, and often a combination of treatments is the most effective. It's also worth noting that while premature ejaculation can be frustrating, it's not inherently harmful. It doesn't pose a threat to your physical health, but it can cause stress, anxiety, and problems in your relationship. That's why it's important to seek help if you're struggling with this issue. Now that we understand the problem, we can begin to address it. The good news is that there are many strategies and treatments available, from behavioral techniques to medical treatments and psychological therapies, but we'll dive deeper into these solutions in the next scenes, so stay tuned. Now let's explore some behavioral techniques that can help. One of the most common techniques is the start-stop method. This technique is quite simple to understand, but requires a bit of practice to master. Essentially, it involves stimulating the penis and stopping before you feel like you are about to ejaculate. Pause the stimulation for 30 to 60 seconds and then start it again once you feel that you're back in control. This method allows you to gain better control over your ejaculation and prolong your sexual experience. Another technique is the squeeze method. This method is similar to the start-stop method, but with an added step. When you feel that you're about to ejaculate, instead of simply stopping the stimulation, you or your partner squeezes the base of the penis for about 30 seconds. This pressure can often help delay ejaculation, giving you more control. After the squeeze, wait for about 30 seconds and then go back to stimulation. It's important to understand that these techniques are not a one-size-fits-all solution. They take time, practice, and patience to master. You might not notice immediate changes, but don't be discouraged. Consistency is key. Both of these methods can be practiced alone or with a partner. When practicing these techniques, it is essential to be in a relaxed state and not put too much pressure on performance. Remember, the goal is to understand your body's response and learn how to control it. It's also worth noting that these techniques can be combined with other treatments for premature ejaculation, such as medical treatments or psychological therapy, for better results. Incorporating these behavioral techniques into your sexual routine can help manage premature ejaculation. They can enhance your sexual satisfaction and boost your confidence in sexual situations. These techniques require patience and practice, but they can be very effective. With time and consistency, you may find these methods significantly improve your control over ejaculation and enhance your sexual experience. In some cases, medical treatments may be necessary. Now, let's delve into the world of medical treatments available for premature ejaculation. It's important to note that these treatments should never be used as a first resort without consulting with a healthcare provider. Let's begin with topical anesthetics. These are creams or sprays that contain a numbing agent. When applied to the penis, they can help to delay ejaculation by reducing sensation. These products are applied a short time before sexual activity and then wiped off so that sensation is preserved and partners aren't also numbed. Then there are prescription medications. Some antidepressants, such as selective serotonin reuptake inhibitors or SSRIs, are often used to treat premature ejaculation. They work by inhibiting the reuptake of serotonin in the brain, which can help to delay ejaculation. These medications are generally taken daily, and it may take a few weeks to see improvements. Another type of medication that might be recommended is phosphodiesterase 5 inhibitors. These are the same medications used to treat erectile dysfunction. They don't directly affect your ability to delay ejaculation, but they can help if you're finding it difficult to maintain an erection. There's also a class of medications called analgesics. Some of these, like tramadol, may be used in treating premature ejaculation. They can help to delay ejaculation by reducing the signal to the brain that triggers the reflex. It's crucial to remember, though, that all these medications come with potential side effects. They may interact with other medications you're taking or exacerbate pre-existing health conditions. That's why it's so important to consult with a healthcare provider before starting any new treatment. In addition to these treatments, there are also a few medical devices that can help. For instance, the use of a special condom or a penile ring may also assist in delaying ejaculation. Remember, it's always best to consult with a healthcare provider before starting any new treatment. While these medical treatments can be effective, they're only one piece of the puzzle in managing premature ejaculation. It's equally important to explore behavioral techniques and psychological therapies, which we'll discuss in the next scene. Psychological therapy can also be a powerful tool. When it comes to managing premature ejaculation, it's not just about physical techniques or medical treatments. The mind plays a pivotal role too. This is where psychological therapy comes in. It can be a game changer whether you opt for individual therapy or couples therapy. So why therapy? Well, premature ejaculation can often stem from psychological factors. These could range from stress and anxiety to issues with self-esteem or relationship problems. Therapy can help tackle these underlying issues head-on. It can help you understand and address the emotional facets that may be contributing to premature ejaculation. Individual therapy can be a safe space for you to explore your feelings and thoughts. It can help you identify any negative thought patterns or behaviors that may be contributing to premature ejaculation. Therapists can provide you with tools and strategies to manage these patterns, ultimately helping you gain better control over your ejaculation. On the other hand, couples therapy can be beneficial if relationship issues are a contributing factor. It allows both partners to openly discuss their feelings and concerns. It's a platform where you can work together to find solutions, improve communication, and strengthen your emotional connection. This mutual understanding and intimacy can, in turn, help manage premature ejaculation. The benefits of therapy are wide-ranging. It not only helps manage premature ejaculation, but also improves your overall mental well-being. It can boost your self-confidence, reduce anxiety, and enhance your relationship dynamics. But remember, therapy is not a quick fix. It requires time, patience, and commitment. It's about gradual progress and long-term change. And it's important to find a therapist you're comfortable with, someone who understands your concerns and can guide you through this journey. So don't shy away from seeking psychological help. Embrace it as an integral part of your journey towards managing premature ejaculation. After all, it's about holistic healing, not just physical, but emotional and psychological too. Therapy can be a powerful tool in your arsenal against premature ejaculation. Premature ejaculation is a common issue, but there are many solutions available. We've covered a lot of ground today, so let's quickly recap. Firstly, understanding the issue is key. Premature ejaculation is not a cause for embarrassment or stress. It's a common occurrence for many men, and understanding this can help alleviate some of the mental pressure associated with it. We then explored behavioral techniques, including the start-stop method and the squeeze technique. These methods can help you gain better control over your ejaculation. Next, we discussed medical treatments. From topical anesthetics to oral medications, there are various options to consider. Lastly, we delved into psychological therapy. Whether it's cognitive behavioral therapy or couples therapy, speaking to a professional can be incredibly helpful. Remember, everyone's body is different, and what works for one person may not work for another. Find what works for you. And most importantly, remember that you're not alone in this. If you enjoyed this video and got any value from it, please like and subscribe for more quality content. Thank you.